As always, let me summarize what we've learned in this chapter on dilated cardiomyopathy. First, dilated cardiomyopathy is a common cause of heart failure. It's defined as a primary myocardial disease, which sets it apart, for example, from ischemic disease. Usually we have a dilated left ventricle. There are variations, regional variations, with respect to what the cause of dilated cardiomyopathy is. But we know that genetic factors play an important role, such as non-compaction syndrome, inflammation, myocarditis, immunologic factors, toxic agents such as chemotherapy, and that many patients are classified as so-called idiopathic cardiomyopathy, where we do not know what the true cause actually is. Echo is important to make the diagnosis, to determine how severe left ventricular function is impaired. In some cases, we can figure out what the cause is. We have a number of different things to look at that will help us to determine what the prognosis is. We can see complications, for example, thrombi, and it helps us to guide treatment. When you perform an echo, you should not only look at left ventricular function, but also at right ventricular function, because that is an important factor that determines prognosis. Look at diastolic function. Here we have a very good indicator of left ventricular filling pressures. Mitral regurgitation is very important because it is an additional burden to the ventricle and thereby brings the ship to sink. And dysynchrony should be detected because we have treatment options for such patients. Be aware that there are specific forms of cardiomyopathy. We talked about ischemic cardiomyopathy, hypertensive cardiomyopathy, non-compaction syndrome, peripartal cardiomyopathy, Chagas disease, and tachycardia, as well as arrhythmia-mediated cardiomyopathy.